This lecture is about the iliotibial band syndrome, which is also known as the iliotibial tract. It's a connective tissue or a thick band of a fascia that runs from outside of your hip to outside of your thigh and knee down to the top of your shin bones. So it helps to extend, abduct, and rotate your hip. It's composed of a dense fibrous connective tissue that appears from a tensor fasciae lata and a gluteus maximus. So this is a gluteus maximus muscle, and this is the tensor fasciae lata, and the iliotibial band originates from the iliac crest and gets attached to the lateral tibial portal. There's a cartilage tubercle where the iliotibial band inserts into it. So it's present along the lateral thigh. Iliotibial band syndrome is an overuse syndrome that occurs from the repetitive activities, often in the long distance runners and bicyclists and hikers. So it presents with a pain or tenderness along the lateral aspect of a knee and superior to the joint line. It can be caused by the anatomical issues like the leg length discrepancy, abnormal tilt of the pelvis, and a bowed legs like a varum and a fat fluid. This may cause ITB to become tight, leading to the increased friction and irritation. Other causes may be the training errors, which can develop ITBS, and rotating your foot or ankle inward when you walk or run, or rotating your legs inward when you walk or run can lead to the iliotibial band syndrome. Muscle weakness of the hip abductors is also be associated with the iliotibial band syndrome, as this causes increased hip internal rotation and the adduction. Not warming up and cooling down properly before starting an exercise sports activity, not resting enough between the workouts, and training on a wrong surfaces. Clinical presentations will include the activities that require repetitive knee flexion and extension activities, tenderness and swelling felt over the femoral condyles where the bursa or the sag is located. There is a sharp pain on the outer aspect of a knee when the heel strikes the floor that can radiate into the outer thigh or the calf. Pain gets worse when running or coming down the stairs, feeling a click and a pop sound outside the knee, and a pain on the lateral aspect of a knee during running, which is increased while descending stairs or you're running down the hill, and the pain is exacerbated when there's a long distance running. Next is a diagnosis. So some provocative test for the ITB band is Greenwich test. So it is performed in the standing position, and the examiner stands in the front of the affected knee and put pressure on the lateral epicondyle with the patient then asked to squat. So a positive test is indicated by the presence of pain at 30 degrees of flexions. Next is a Nobel compression test, which is performed in a supine position, and the examiner places a finger on a lateral femoral condyle with the knee slowly extends. So a positive test is indicated when the pain is felt at 30 degrees when the ITB passes over the lateral femoral condyle. Next is a Uber's test. The patient should be in side lying with the affected side up and bottom knee, and the hips should be flexed to flatten the lumbar curve. So stand behind the patient and stabilize the pelvis to prevent movement in any of the directions. So grab the distal end of a patient's affected leg and stand and adduct the hip joint. Slowly lower the leg towards the table. Ensure the hip does not internally rotate and flex during the test, and the pelvis must be stabilized. So if there is iliotibial band is tight, the leg would remain in adducted position and the patient would experience the lateral knee pain. In this case, test will be positive. Next is a physical therapy. So what you can perform is use of foam roller on the tight muscles could also be beneficial. A possible exercise is to lie on the side with the foam roller position perpendicular to the bottom leg. muscles below the hip bone, using the hands for the support. Roll from the top of the outer thigh down to just above the knee. Straighten the front leg during the movement. So exercises to strengthen the abductor muscles and stabilizes the hip can be very helpful. So iliotibial band is often associated with the abductor weakness. Strengthening and stabilizing will be beneficial in the treatment of ITP. Next, what you can perform is the hip hikes in a standing position to strengthen your gluteus medius, because the muscles of the sides, and a side lying hip abduction, one leg bridging in a supine position, single leg step down, and a single leg wall squat.